Welcome to our COVID vaccine information session on children 5 to 11. I'm Dr. David Colby, your medical officer of health. You know, vaccination is a tremendous advance in medicine and has contributed to the downfall of many diseases, and we're hoping COVID-19 as well. Hanging a wanted poster in your post office so your immune system recognizes the invaders before they get a chance to cause mayhem, that's a great idea. These vaccines have been fully tested and approved by Health Canada, and we've got the experience of the United States with over 3 million children immunized already without problems. Kids get sick too from COVID, and not only can they get sick, and sometimes seriously sick, they can transmit it to others. So we're very excited to have our presentation tonight. Kim and Dan have got a marvelous information session all ready for you, so I'm going to ask them to take it away.
Excellent. Thank you very much, Dr. Colby. Hello, everyone. Thank you for joining us tonight. You're here for the COVID-19 vaccine question and answer session with public health nurses for children 5 to 11. Before we get into that, though, I'm going to read a land acknowledgement. So the land that is known as Chatham-Kent today is the traditional land of the Three Fires Confederacy, the Odawa, the Potawatomi, and the Ojibwe. These indigenous nations, known as the Anishinaabeg and Lunaapu, agreed to the mutual sharing of the land with obligations and responsibilities to the environment. Chatham-Kent neighbors the Lunaapu at Delaware Nation, which is part of the McKee Purchase Treaty, as well as the unceded territory of the Bequejewanong-Walpole Island First Nation. Chatham-Kent continues to be home to diverse First Nations peoples and Métis peoples. This land was settled through the McKee Purchase Treaty of 1790, and we, as beneficiaries of the treaty, recognize our responsibilities, including our collective responsibilities to the land and water. Today, these responsibilities and obligations extend to all peoples. We invite you to reflect upon this land acknowledgement and what it means to you and how you are upholding the Truth and Reconciliation Commission's call to action. So with that, we'll get started here. So I'd like to just start by introducing myself. My name's Dan Drulard. I'm a public health nurse with Chatham-Kent Public Health. I've been in this role for close to 10 years now, mainly focusing in vaccine preventable diseases. So before COVID, I was immunizing babies through seniors with routine vaccinations, going into the schools, providing the usual shots we provide in grade 7, and then providing information and advice to the public and healthcare providers as they need it. With me tonight, we also have another public health nurse, Kim Logan. Hi, Kim. How are you tonight?
Hi, I'm great. How are you, Dan?
I'm doing well, thanks. Would you like to tell the folks a little bit about yourself?
Sure. So my experience is very similar to Dan. So I've been with CK Public Health for the last 7 years. Prior to this, I worked in acute hospital in London, and I'm currently working on the school of health team where we do go in and provide those immunizations, typically for grade 7 and 8 students. So we have provided those school-based immunizations lots of times. And most recently, I've been working with all things related to COVID-19. I do also have experience in working our in-house immunization clinics, and then these focus on all ages from our little ones right up to adults.
That's great, Kim. I know that you have a wealth of experience and knowledge to bring to the presentation tonight. And I guess what we're also counting on is some participation from our audience in the form of some questions we'll be happy to answer. But before we get into that, we do have a brief presentation with you just to cover some of the more common questions that we've been getting in advance of tonight's session, as well as some information that we just think you should know going into this important decision, which is deciding whether or not to get your child aged between 5 and 11 the COVID-19 vaccine. So I think we'll just get right into it if we can. While we're waiting for the presentation to come up, I'll just acknowledge the folks behind the scenes that are making this happen. We've got a team of staff working to get everything up on screen for us to sort of help organize your questions and make sure everything runs smoothly on the back end. So thanks a lot to everyone involved here tonight. So I'll just say for people watching this later on through the recording, that this presentation was drafted yesterday, November 24th, and delivered today on November 25th, 2021. So the information and data shared today is current as of today. So just a few things about children and COVID-19. So it is known that fewer children have been infected with COVID-19 compared to adults. But despite this fact, kids can still get sick from COVID-19. Um, and they can get quite sick sometimes. In some cases, they can get a condition called multi-system inflammatory syndrome. There's been cases of myocarditis, COVID long hauler syndrome, or long COVID, as I've heard it called. Not only that, children can also spread COVID-19 to others. And we all know that they can have and have had their lives disrupted by public health measures, including school closures and not being able to play with friends. And children are also in high risk environments every day as a result of being in school. We know that COVID is much more likely to be transmitted indoors where people are gathered for long periods of time. And school is kind of a textbook example of what those sorts of situations would look like. But the good news is that now recently Health Canada has approved the pediatric formulation of the Pfizer vaccine for children 5 to 11 years. And that means that kids now have the power to protect themselves and their community from COVID-19. Next slide, please. So while we're going through this presentation, just keep in mind that you can book pediatric appointments through our booking system. The Bradley Center is going to start administering those vaccines on Saturday. And you can book an appointment by going online at getyourshotck.ca or by calling the phone number 519-351-1010. You'll probably have to leave a message. We're getting a lot of calls for booking, but our agents do get back quite quickly and will do their best to get to you as soon as possible and get that appointment booked. Next slide, please. So I wanted to compare a little bit about the differences and similarities between the adult formulation of the Pfizer vaccine and the children's formulation. There is some slight differences, mainly in the dosing. So the adult version of the COVID-19 vaccine provided 30 micrograms of the active ingredient to get the immune system responding. The children's vaccine only contains 10 micrograms of that same material to elicit the same or similar immune response. The dose volume is slightly less, as you would expect. And there's a little bit of a difference right now in the timing or the spacing between the first two doses. So right now, for adults and the general population, basically anyone over 12, the recommendation is at least 4 weeks or 28-day spacing in between your first and second doses. For children, we're recommending, or not we necessarily, but Health Canada, NACI, and the provincial government are recommending 8-week spacing between first and second doses for children, which equates to 56 days. And the reason for this is sort of a few things. First, evidence has been showing that spreading out the distance between those two shots can result in a better immune response, maybe even a longer lasting immune response. Also, it's believed to be resulting in less side effects of the vaccination after second doses. So that is the recommendation as it stands right now. You'll notice the asterisks on the screen, and that just indicates that these are guidelines right now that may change as further information becomes available. The last line I have there, the difference between the vaccines is right now for adults, there's no spacing requirement between getting a COVID-19 vaccine and getting any other vaccine, say tetanus or flu or anything like that. But for children, we are currently recommending a 14-day space between the COVID-19 and any other vaccine. And that's not because there's risk of a cross reaction or anything like that. It's more because we want to monitor the effects of the vaccine and make sure we can determine if someone's having a reaction, is it because of the COVID-19 vaccine or is it because of another vaccine? And if we don't allow those to be given in close to the same time, then we don't have to do that kind of guesswork. So what information do we have to show us that these vaccines are safe and that they work? Well, Health Canada has gone through a rigorous assessment of the data submitted and an independent review of all the information, and they've deemed that it's safe and effective. So they mentioned the clinical trials conducted in the US, Finland, Poland, and Spain, where just under 5,000 children were enrolled in these initial trials. It found that the vaccine was estimated to be 90.7% effective against symptomatic COVID-19 disease after the second dose. There have been no serious safety concerns identified. There have been no cases of myocarditis or pericarditis identified, as there were with the 12 to 17 cohort. There was a little bit of a concern there for a little bit. Um, and the study will, of course, continue to monitor these patients for an additional 2 years after they were immunized. And then, of course, as part of the greater public health system, as is done with all vaccines, there will be ongoing monitoring to detect any potential or more rare events. And that's done through the reporting of APHEs, or adverse events following immunization. And those can be submitted by anybody really, but usually they're submitted by healthcare providers. And then those are reported to Public Health Ontario and Health Canada, and they keep track of the findings. And then if any safety signals are detected, that's when there's processes in place to either stop the vaccine from being administered. As we saw earlier in the year with the AstraZeneca vaccine, that was put on hold for a while following some safety signals that were identified. So vaccines have the power to hopefully get us out of this pandemic. We've been doing great getting the rest of the population immunized in the mid to upper 80%. But we're really missing a key demographic, and that is obviously our children. They're out, like I said, daily in school, in congregate settings, indoors, close contact with each other. And that's definitely showing as well in the case numbers lately. So hopefully we can get vaccines into this age group and knock those cases down even further in those settings and in this age, and get us back to where we want to be again. So vaccines are most powerful and useful when you get one at the appropriate time. So as soon as you can in this case, and get your first and second dose as required and subsequent boosters as required. And obviously, until enough people are vaccinated and we notice case counts going down, we'll need people to continue with public health measures, which we've all become quite familiar with over the past couple of years. Distancing, mask wearing, hand washing, that sort of thing. So now I'll talk a little bit about what the virus is and how the vaccine works. So for those that don't know or haven't seen any of our previous presentations, this is sort of a basic overview of viruses and vaccines. So a virus looks like a ball with a bunch of spikes on the outside of it. And inside it has instructions to make new viruses. And so these spikes are like fingerprints, and every type of virus has different types of spikes. And so we create vaccines to recognize these spikes and or to have our bodies recognize them rather. So the mRNA vaccine only contains the genetic code to create those spikes. So your body's going to make all of those spike proteins so that they will recognize it, like Dr. Colby said, putting up a wanted poster. And then when the real virus, if the real virus ever presents itself inside your body already knows what it looks like and what to do with it to get rid of it, basically. So that's the goal of viruses, where your body, or the vaccines rather. So this vaccine will have your body make the spike proteins so that your body can recognize the virus instead of getting infected with the virus. And then your body's trying to learn what to do with it on top of being overwhelmed with this virus replicating in your body. You have much better chance with the vaccine than without the vaccine. So as you can see in this illustration, the wanted poster's up with the spike protein, and we see the immune cells in the greeny color chasing after the blue guy. Obviously, he's a COVID-19 virus with the spike proteins on him, easily identified by those. So what type of vaccine would I be getting if you're a child 5 to 11? Well, as it stands today, the only vaccine currently approved for this age group is the Pfizer-BioNTech Comirnaty vaccine, I believe is what they've named it. So children who turn 12 in 2022 should not delay the vaccine for an adult dose. Get the vaccine as soon as possible as you can. Get the pediatric dose is more than acceptable. If you do get the pediatric vaccine at 11 and then turn 12 before it's time for your second dose, you will be provided with the adult formulation at that time. As far as vaccine approval goes, I mentioned earlier that Health Canada performed an independent, rigorous review of all the data, and that absolutely did happen. It's illegal to sell or market a vaccine that hasn't completed all stage of research and testing. So Health Canada would not have been able to authorize this vaccine if that was the case. And like I said, they do the review independently. The company submits the information to Health Canada, and then they go through independently and verify the information and make sure it all makes sense and adds up. So what are in these COVID-19 vaccines, you might ask? Well, COVID-19 vaccines are actually pretty basic when it comes down to it. All they contain is fat-coated mRNA. So the mRNA is the genetic material for the spike proteins that your body's going to reproduce. And they're fat-coated just because your cells like to, it helps those mRNAs strands get absorbed into your cell easier so that they can be made. It also contains salts, sugars, polyethylene glycol, and water. And these are used to either help the mRNA enter your cells so they can be reproduced, or they help to stimulate your immune response, or they just provide a little bit of a vehicle to get the ingredients from the syringe into the arm. Many of these ingredients are also found in things we consume or use every day. Obviously, water, salt, and sugar, polyethylene glycols in many cosmetics and foods. Each ingredient's measured precisely. It's not like they're willy-nilly, throwing in all these ingredients in. They're measured precisely. They use the minimal amount possible to achieve the desired effect. And the vaccines do not contain any other common allergies that people have, like latex, for example, or antibiotics. Now, what are the common side effects? It's a great question. And for children, it's pretty well similar to what we see in adults. In the arm where you get the shot, you might get a little bit of pain, a little bit of redness or swelling afterwards for a day or so. As far as the rest of your body, you could feel a little bit tired, maybe a headache, muscle pains, chill, fever, nausea. Those are signs that the vaccine is working and engaging your immune response. Not to worry if you don't have any side effects, that doesn't mean your immune system isn't working. It's just that not everybody will experience them. But what's interesting is that we have heard, it's been reported that some of the more common side effects for adults, like headache, fever, chills, they've been reported less often in the 5 to 11 year age group. And they're pointing towards perhaps the lower concentration of the mRNA, the 10 micrograms opposed to 30 micrograms, and also perhaps the longer spacing in between those shots. That could be explaining the reduced reports of these side effects in the 5 to 11 age group. Serious allergic reactions are rare, even with the adult formulations of COVID-19 vaccines. As for the pediatric, I think last count there was a little over 3.5 million. This slide's a little old, being a day old. But close to 3.5 million doses of the vaccine have now been given to children in the United States, and they have no serious side effects, no safety signals have been identified yet. And of course, however, the vaccine is not recommended, obviously, for anyone who has a known allergy to an ingredient like polyethylene glycol or trimethamine. These are very These substances have very rare allergies. Not a lot of people do, but we recognize that some people do have allergies to these, and the vaccine would not be recommended for them. So you can't get COVID-19 from a COVID-19 vaccine. Like I explained earlier, the vaccine only contains the code to create those spike proteins. In order to create a whole other COVID-19 virus, you would need all of the RNA from inside the virus to duplicate itself, and that's just simply not in the vaccine. Um, it, in order to build immunity, though, it does take a couple weeks. So that's why we don't consider people fully vaccinated until 2 weeks after their second dose. And if anyone ever got COVID-19 after they got their vaccine, chances are they were likely exposed to it before their appointment, and it probably took until after their shot, just coincidentally, for them to start feeling symptomatic and to go get tested for it. So why do we have to get 2 shots? Some people wonder why 1 shot just isn't enough. That's a great question. So 1 shot does provide very good protection against severe disease of COVID-19, but that second shot is going to boost that protection a little bit and help it last longer. So the recommended spacing, like I mentioned, is 8 weeks to help provide that longer protection, and it's reported with less side effects than the shorter 21-day window, which is what was recommended by the manufacturer. So how is the vaccine given? That's a great question. I'm sure the kids all know that, or the kids will want to know how this is done. So the vaccine for children is given just the same way as it's given to adults. It goes into the deltoid muscle, which is the muscle just below your shoulder in your upper arm. So what will happen is you'll meet with the nurse, you'll sit in his or her chair. I shouldn't say nurse, we have paramedics and other health professionals, so I'll say immunizer. You'll sit with an immunizer at the table, and they'll ask you some questions about your health and make sure that you understand what the vaccine is all about. And then when you're ready, they'll have you roll your sleeve up. They'll clean your arm off with a wet alcohol swab. It might be a little bit stinky. And then they will proceed to administer the vaccine. So they'll put the needle in your arm. It just takes a couple seconds to provide the injection. Sit very still for them, and then it'll be all done. You'll have to get up and proceed to a waiting area. Well, you'll wait for 15 to 30 minutes to make sure you're feeling well before you go home. And if you're not feeling well, there's lots and lots of nurses and paramedics and people there to help you and make sure you're feeling better before you head out the doors. And I've heard they've also got some incentives ready for the kids. Not exactly sure what they have planned, whether they've got little toys or stickers or something, but there'll be some sort of incentive there. Um, and I guess I'll talk about the clinic a little bit right now too. So our team sort of transformed the Bradley Center. I mean, when I went there for my vaccine originally, it was amazing just going there and seeing everything that was all set up. But to see it now transform for children, I think is going to be pretty cool. I'm excited to take my kids there. We're doing a superhero theme, from what I understand, and there'll be balloons and lots of volunteers there to help people find their ways and make sure you're getting to the right table for the right shot. And I just think it's going to be great, and we'll hopefully put a positive spin on this. Otherwise, this activity that we'd probably rather not do. So anyway. After your vaccine, like I said, you'll wait in the clinic area for 15 to 30 minutes just to make sure you're feeling well and let someone know if you don't feel well. Now, if you're nervous about needles or nervous about getting a shot, then it's understandable. There's lots of people that have that fear. Even some of the nurses I work with don't like to get needles, but it's sort of a fact of life. And there's some things that you can do to help yourselves get through the experience a little bit easier. So the first thing that I like to recommend is that you just talk to people. Just talk to the nurse, talk to the paramedic, whoever's giving you your shot. Let them know you're a little bit nervous about it. They have strategies that they can help you use to sort of calm your feelings or distract you while you're in their chair. And just being upfront with them and letting them know you're nervous is the very first step. Bring someone with you if that would make you feel more comfortable. Obviously, if they're children, they'll have their parents with them, which will hopefully help to ease their minds a little bit. But that's the first step. Definitely, just be open and say, I'm a little bit nervous about this. Can we take our time, or can we go slow, or can you tell me what you're doing, or whatever you need. the staff there will make sure that it's as pleasant as possible. The next thing that's a recommendation is to distract yourself. So bring something with you that you can focus on while you're getting your shot, whether it's a book to read or you want to bring music to listen to, or just chat with someone, or a fidget toy, or something along those lines. Anything that can kind of help you keep your mind off of being in the chair and getting your needle. The next tip is to look away. That'll help achieve a couple things. One, you won't necessarily know exactly when you're getting the needle, and sometimes that's enough to make you not even feel it in the first place. Um, some people like to watch, and that's okay too, whatever your preference is. And often I even recommend that people don't watch the immunizer get the vaccine ready, whether it's even just taking the cap off the needle or opening the band-aids. Sometimes that can even be unpleasant for people. So try to use those distraction techniques. Obviously, pay attention to the immunizer and answer their questions when they're talking to you, but otherwise distract yourself, look away, and it just takes a few seconds. Now, there's other resources that we have available online. We've created a page for the kids' COVID-19 vaccination, ckphu.com/superkidsvaccine. It's a great webpage to go to for lots of different resources. We're going to post some links in the comment box, and you'll find some things there for preparing your children for vaccination. The card system, which includes a little bit of the strategies that I just talked about. And there's lots of different there's a guide to vaccination and some social stories as well in there from people. A little bit about medications before vaccination, because some parents are asking about that. So first, I'll mention that there is a topical numbing cream that you can purchase over the counter at pharmacies, and this gets applied to the skin. Depending on the brand of the cream, it could be applied anywhere up to an hour before the injection. And it basically has a little bit of numbing agent in it that will numb the area so that the needle won't be felt at all. Some of them do last quite a bit longer, so just be aware of that the numbness might last a little bit or well after the immunization is provided. And the prices I have on screen, they are Alberta prices, so I don't know if they're necessarily reflective of Ontario, but it was just an example of the products out there. And I believe this resource in more detail is available on that Super Kids vaccine website that I mentioned last slide as well. Now, as far as pain and fever relief go for vaccination, it's not recommended to give, Tylenol or Motrin before or during the vaccine appointment. But after the vaccine, if you find that your child has a fever or is, feeling a little bit sore or achy, absolutely fine. Treat those symptoms with Tylenol or Motrin. Make them feel comfortable after their shot. Excuse me. So now I wanted to talk a little bit about consent. Um, there's been a lot of speculation out there, I guess, about consent and children and whether nurses will be going into schools and immunizing kids without permission and whatnot. And that's absolutely not true. Not something that we would do, not something I won't want done for my children. It just doesn't make sense all around. So parents will provide consent for their 5 to 11-year-olds. It's actually public health unit policy that anyone under 14 must have parental consent. And even often people older than 14, we get parental consent. But our policy is anybody under the age of 14 must have the consent of a parent or guardian in order for us to provide the immunization. Now, even though the parent is providing consent, it's still important that the individual getting the shot uh, understands what they're there for. They understand what vaccination involves, they understand why they're getting the vaccine, and they understand the risks and benefits of either accepting or refusing the vaccine. So kids, maybe not the younger ones, although I encourage it for sure, but definitely the older ones. Talk to your parent or your guardian or an adult you trust about your vaccinations. Seek out credible sources of information to inform your decision. There's a lot of misinformation flying around out there on social media. Please turn to credible, knowledgeable, expert resources for your information. And again, I will just reiterate, very important, anyone under the age of 14 will be required to have a trusted adult with them at their appointment and to provide consent for that vaccination. So where can you get a COVID-19 vaccine? I mentioned it at the beginning of the presentation. The Bradley Center is transformed into a superhero-themed kids vaccination clinic starting on Saturday. Pfizer pediatric vaccine will be available in some local pharmacies soon. And we're also setting up some school-based community clinics. And so with that, I guess I'll also address there's been some rumors that we're going to be going into elementary schools and just giving kids the vaccination. No, absolutely not true. And just to further illustrate that point, we've purposely are going to be scheduling these school clinics at high schools. They will be after school hours. So the kids will not even be there unless the parents are able to bring them. Right now, we're working with Blenheim District High School and Wallaceburg District Secondary and Tilbury District High School to plan and offer clinics out of their cafeterias after school hours. And I anticipate appointments and information will be available in the next few days on when these clinics are and when you can book in for them. So again, I will reiterate, please look for credible sources of information for your decision to be vaccinated. Avoid misinformation on the social media channels. Anybody from anywhere can post anything they want on those. They're just not good places to go for info. Good places to go for an online yard sale, not for health information. So we have, like I said, a dedicated webpage, ckphu.com/superkidsvaccine. Also, Health Canada website. Ontario COVID-19 website has a wealth of information and resources. Even different health organizations, different health units in Ontario, but wherever you get your information, make sure it's credible, make sure it's backed by expert opinion. And if you wanted to ask us a question, of course, we're going to get into a live question and answer session here shortly, but we're available Monday to Friday, 8:30 to 4:30 for any questions. We've set up extension 1900 to field all of our COVID-19 inquiries. There's also been a Sick Kids Hospital has opened up a vaccine consult service for anyone that wants to discuss vaccination of their children with them. You can book an appointment at that website, sickkids.ca/vaccine consult, or call that phone number to book an appointment to speak with a consultant, which I think is a great service they've offered. So just some references that we've used to create the presentation tonight. And with that, I think we're ready to get into some questions. What do you think, Kim?
That sounds great, Dan. Thanks for all that information. So we're really here tonight to help everyone feel comfortable and confident in your decision about vaccines. So certainly submit your questions if you do have some. Do we have some to get started here, Dan?
Sorry, just taking a drink there, getting a little scratchy in the voice. So we've got our first question here from Janice. Could you explain the pop-up clinics again? What types will you have? So I just mentioned really the school-based pop-up clinics, I guess, which isn't completely fair. So yes, so we have the Bradley Center clinics, obviously. We're going to be scheduling those clinics at the high schools in the cafeteria. And then also we're working with some other community partners to help provide pediatric vaccine doses to other sort of special populations, sort of through, I don't know necessarily exactly what agencies we're working with, but children's-based agencies anyway. Also, there will be pediatric vaccine available at pharmacies as well in the near future.
The other thing, if I might add, Dan, is that just for the process piece with the immunizations at the Bradley Center, and for anyone that has visited that location, what you will notice it has changed quite a bit with for the 5 to 11-year-olds. So they will be immunized in separate lines. So you'll basically follow the balloons with the kids. There'll be separate lines for them to check in and get registered. And then while they're waiting to be taken to a table, and there'll be separate tables for children as well, with some additional privacy screens added. Like Dan mentioned, there are some little activities, things to kind of keep kids busy, some giveaways. I'll let you find out at the time. I don't want to spoil that for anyone. But there definitely will be separation within the Bradley for the children 5 to 11 that are coming in, and the adults that might be coming in for boosters at the same time, just so there's no concerns that way as well.
That's great. Yeah, I'm glad you pointed that out, Kim. I haven't really seen or heard the whole story about what's going on in there, but I understand it's going to be um, pretty great for the kids to get them through that experience. So, looks like we have another question. When or should kids who've recently been infected with COVID-19 get vaccinated? So, when or should kids who are infected with COVID-19 get vaccinated? Kim, did you want to take this one?
Absolutely. So, children who have been infected with COVID-19 do have some natural immunity from that infection, they're believed to, but that immunity we know only lasts for a short period of time. So, it's believed about 3 months is sort of that time that you can expect that natural immunity to last, give or take a little, right? Because we don't know exactly how everyone will respond to any given virus. That being said, children that are infected with COVID-19 are eligible for vaccination as soon as their acute phase of their infection is over and they're released from isolation. So, usually, isolation for those that are ill with COVID-19 is 10 days, kind of from the time their symptoms started. It can be a little longer than that if they're still ill or seriously ill, certainly. But once public health has cleared them from their isolation and consider them recovered from their infection, then they're good to go ahead and proceed with vaccination.
Great. Another question here. If we have a child who's fearful of the shot and may cause a scene, is there an area that's more private so they don't scare the other kids? Kim, do you know much more about this one? I don't know too
Yeah,
much about what's been done extra in the clinic.
I'm not entirely sure either. I haven't seen it myself. I am looking forward to seeing it this weekend when I take my children for their vaccine. Fortunately, they're within this age group. I do have a child that is fearful of needles as well, so I can completely understand that for sure. So I understand there will be more partitions in place, so your child will not be visible to other people in the waiting area. And I would say if you do have something that your child has, like a favorite stuffy or something that you find as a parent really helps to support them, I would recommend that you bring those familiar items because for some children that makes a big difference. So people in the post-vaccination area will not be able to see. There will be some music in the background. There will be some displays, some decorations and whatnot to go along with the theme. If your child enjoys superhero or is interested in participating in the theme, maybe allow them to dress up like a superhero if that's something that they're interested in. And certainly that can make the experience maybe a little lighter feeling, right? As Dan said, this isn't really an activity that people look forward to generally, but we are trying to make it as children friendly as we can. And when you book your appointment, there's also an opportunity to make a note of this to public health as well. And if we need more info about your specific child, if there is a scenario there that we can assist with, and if it's a really extreme case, please reach out to us and we can come up with a solution with you for sure. And Dan did talk to you about those numbing creams and that. I don't know if that is something that you'd be interested or not, but it might be worth discussing with your child if you are open to those types of things to see if that's something that they would feel more comfortable with or that they would like to try. But as much as we can give children some empowerment in these situations and a little bit of choice, I think that's always a really good strategy.
Yeah, those are all really good points, Kim. And I'll just, I guess, add on top of putting the note when you book, maybe let the staff know when you get to the clinic for your appointment that your child's a little bit more fearful and might need a little bit more attention or time or that sort of thing. Um, Definitely be helpful to bring that up beforehand. Thank you for that question, by the way. That was a good question. So next question is from Heather. My daughter is turning 12 in early 2022, so 11 now, turning 12 next year. She is larger both in height and weight than some small adults. Do we wait for an adult dose for her? So I guess the question is there any worry that children that are a little bit larger should be getting an adult dose versus a pediatric dose?
Yeah, so there's actually no concern with a child that is still 11, turning 12 in early 2022 of having the pediatric dose. So that is absolutely a safe dose to go ahead and have. When your daughter does turn 12, then in 2022, she should expect to have the adult dose at that time. But even if she has one pediatric dose and one adult dose, she is considered fully immunized. We typically do not recommend delaying vaccination for these types of reasons because your child then remains at risk of actually catching COVID-19. And like Dan mentioned, there can be some, consequences, even though most children don't generally get sick. We did see in the US when you had many, many children infected, that then there were more hospitalizations and serious illness just because the number of children infected all at once, right? In the fall, there were pediatricians sounding the alarm saying that their hospitals were being overwhelmed with pediatric cases. So I would not delay, and your child will be considered fully immunized with one dose of each.
Yeah, I guess I'll just also add to that that the dosing for vaccines isn't necessarily based on body size or weight like a Tylenol or Motrin would be for children. They're based on the development of the immune system at that time. And so despite children being of different sizes, their immune systems in general are among the same developmental sort of stage. And that's more what the vaccine dosing is based on. So like Kim said, more important to get vaccinated sooner than later, especially when we send our kids every day to those high risk settings that I talked about earlier. And especially in the elementary schools, there's no vaccinated people other than hopefully the teachers in those rooms. So lots of opportunity for transmission. And with the holidays just around the corner, I know there won't be enough time to get kids fully vaccinated before the holidays, but getting them one dose at least will be better than nothing before we all want to get together with our loved ones for hopefully our last modified Christmas celebration or holiday celebration this year. So a great question. I hope we answered it. And uh, thank you very much for asking it. Next question from Kristen. Thanks for the question, Kristen. Will the 5 to 11 vaccines be done by birth year rather than by specific birth date once the new year comes? Will children have to wait until they actually turn 5 or once we're into 2022? So I think the question is, so kids that are 4 now turning 5 next year, are they all going to be eligible on January 1st, or will they have to wait until their birthday till they turn 5? I know this is a question that I've been asked or been asking. My oldest is 4. He's going to be 5 in the early part of 2022. And the answer to this question is that we're still waiting on the guidance for that. So right now the focus is on the 2021 birth year. So currently, when we start giving shots on Saturday, anybody born in 2021, and then obviously the years after leading up to 11 years old, or sorry, 2016, sorry,
2016.
we're in 2021 right now. The children born in 2016 are all eligible as of this Saturday to get shots. As for the 2017 birth years who are turning 5 next year, to be determined, keep your eyes and ears tuned to us for updates. I think we're getting into a period again of frequent updates to guidance and information. So just keep your ears and eyes tuned. And once that information is provided to us, we'll definitely forward it on to the public. Anything to add on that one, Kim?
I don't think so. Yeah, it's the 2016 and under right now that are eligible, and then just stay tuned for more information. As we know, we certainly will get that out to the public for sure.
Okay. Next question is, can children receive the flu vaccine and COVID-19 vaccine at the same time frame?
So in adults, that they now can receive COVID vaccine with other shots at the same time. But when children right now, in Dan's presentation, he did mention that there is a 14-day period before your COVID shot that you're not going to want to have any other shots. And it is a very precautionary approach to this. And it is just like Dan mentioned in the presentation, that we really want to know if any side effects are related to one specific vaccine or the other. In the case of adults, initially we did this same kind of thing, right? The recommendations came out, and it was, you had to have your vaccine spaced out by this much with any other vaccines. And now we're at a point that so many adults adults have had the vaccine and it's still considered safe and effective with other shots, that there's no concern about them having them at the same time. So at this time, no, they cannot have them at the same time, but that may change in the future depending on how things go here on out.
Yeah, great. And I guess I'll just add that that doesn't just apply to the flu vaccine and COVID-19 vaccine. Kim did mention that, but I just want to be clear, the COVID-19 and any other vaccine. So if your kids are between 4 and 6 and due for those school-age booster shots, even those are going to want to be spaced at least 2 weeks away from the COVID-19 vaccine. Okay, the next question.
Oh, we're in the dark
Our
here.
lights timed out on us. We'll get a cameo here from one of our staff. Thanks, Kara. All right, so what is herd immunity, and will child uptake help herd immunity?
Okay, so herd immunity is when enough of the population is protected by vaccine, that the virus has a harder time spreading throughout the population. So you may have heard different estimates originally with COVID when we had these initial versions of like the classic COVID, and then we've had all these variants since then. And we know that these variants spread more easily. So herd immunity that you may have heard from our politicians and whatnot, that those numbers have actually changed over time in terms of what percentage of the population that they want or they feel needs to be fully immunized in order to give herd immunity against COVID-19. So child uptake ultimately would help. So is as we immunize children, teens, and adults, anyone that is immunized then has some protection against COVID-19. Therefore, they do increase the benefit to the whole community by decreasing the amount of spread that we see. Um,
Yeah, and I think the latest figures from the World Health Organization they just released recently was that the COVID-19 vaccines are being shown to reduce transmission um, of COVID-19 by 60% in non-Delta variants and by 40% in Delta variants, which might not sound like a lot, but it's quite significant when you consider that you'd go from almost being guaranteed to infect someone else to it being a coin flip. So I think it's really powerful, and the more people that are vaccinated, the less chance that the vaccine will have to find a suitable host to reproduce and to carry on its lineage. So absolutely, child uptake will help with herd immunity. Thank you for the question. So the next is from Christine. Thank you for the question, Christine. My son is 11 now, and if he gets one dose before 2022, will he still get the children's dose in 2022 as he'll be 12 in the fall of 2022? So it sounds like, so he's 11 now.
Yeah, so he will definitely be eligible for 2 doses of the pediatric vaccine, provided that you were to have the first dose in the close near future, right? Because you would only wait that 8 weeks in between. So your child should be able to have both pediatric doses before the 12th birthday, provided that you do start that series soon, right? Like because they are not turning 12 until the fall, is my understanding of the question.
That makes sense to me. Thank you, Christine. Do we have any more questions? How many doses have been given in other countries, and what types of adverse events are occurring or not occurring in those countries? Kim, did you want to start this one, or did you want me to start this one?
Sure, I can start. I'm not totally familiar with all countries, but I know the US is over 3.5 million in this 5 to 11 age group. And the adverse events, there have been no safety signals identified so far. So, like Dan mentioned, we did see rarely some cases of heart inflammation in teens and sometimes younger adults, and that has not been a concern in the pediatric population. And still we're seeing, those typical things. So arm pain after an injection, some redness at the site, some swelling at the site sometimes a little bit of fatigue and headache afterwards. But we have had no safety signals coming out of other countries at this point, indicating that there's anything else going on in the children 5 to 11. I'm not sure, Dan, do you have any information about other countries at all, in Europe and whatnot?
Yes, that's why I asked you to start, because I knew I had a list here somewhere and I found it. So I do have a list of countries that have been immunizing children with COVID-19 vaccines. Now, some are like in the Middle East and in Asia, and they're using the Chinese Sinovac vaccine, and some are using the Pfizer vaccine. But this is the list of countries. So the United Arab Emirates has been immunizing 3 to 17-year-olds since August. Bahrain has been doing 3 to 11-year-olds since October. China has been immunizing 3 to 17-year-olds since June. Indonesia has been immunizing 6 plus since November 1st. Malaysia, 5 to 11-year-olds since October 29th. Chile, 6 plus since September 6th. Uh, Cuba's vaccination campaign includes children as young as 2 years old. El Salvador is doing 6 to 11-year-olds since September 13th, and Argentina is immunizing children aged 3 plus. So there is a lot of immunizing of children with COVID-19 being happening worldwide, and for actually quite a significant amount of time if we consider that Canada is just getting started at the end of November.
Okay, thanks, Dan. If anyone has more questions, we've only got about 8 to 10 minutes left here, so please get those submitted to us, and we'll try to answer any burning questions that you still may have. And like Dan mentioned before, if there's anything we don't get to tonight, and you want to reach out to us at the health unit or another provider you trust, or that sick kids consult line, absolutely, we encourage you to continue seeking out more information from credible sources.
That's right. And if we don't get to your question tonight, definitely email it in. If you put it in the YouTube comments, you can email it in, and one of our staff will get you a response on the question as well that way. So the next question we have here, Kim, is will the vaccine be mandatory for school or to attend other public places?
Yeah, that's a good question. So at this point, it doesn't sound like it at the moment. But as we know, things have changed as we've moved along through this pandemic, and we've seen numbers rise and fall and these kinds of things. So at this point, it is not part of the plan to our knowledge, but it could eventually. Be the case, right? We don't know. We can't predict the future for sure. But at this point, it is not believed to be added to the ISPA mandatory school immunizations. And as far as public places, there's been no indication that that will happen either. So it'll just be a kind of a wait and see, I think, at this point, Dan.
Now, Kim, I have a follow-up question to that. I wonder if you might help me answer. Um, so right now, when there's a case of COVID-19 in a classroom or in a cohort in a school,
Mhm.
everybody has to isolate, right?
It in this population of 5 to 11-year-olds who are ineligible for vaccine up till now, then yes, in those cases, if there were a confirmed or a probable case within their immediate cohort, then they would be required to isolate for 10 days following that exposure.
Now,
Um,
do you think being vaccinated would change those requirements that those children might be able to remain in school if they're vaccinated?
Yeah, so it absolutely does for the older children. So we see this in our high school cohorts. So that children that actually are fully immunized, so that's 2 weeks after their second dose of vaccine, they do have different recommendations, okay, for that period. So for that 10 days, instead of self-isolating automatically at home away from their family members and loved ones, they actually are allowed to continue to go to school and self-monitor for symptoms. Certainly, we can't have anyone going to school with symptoms whatsoever. As many parents know, we do that daily screening right through the Ontario portal there, and make sure that they're not having any symptoms at all. So even those children self-monitoring, they would be tested immediately if there were symptoms and required to isolate at that point. But as long as they were feeling well and there was no indication that they had picked anything up from an exposure, then yes, they are allowed to attend school during that time. So it has significantly helped in high schools for those students to not have to miss extra time, right? We have seen more outbreaks of late with the Delta variant for sure in schools since previous, because we know that this variant in particular spreads quite easily.
Right. But we've seen more outbreaks in the elementary schools than the high schools this school year, right?
Yes, absolutely.
Right. And
Absolutely.
then probably because of the vaccine status, I would assume. Okay, we'll get to the next question here. So this next question comes from Jill. Thank you, Jill, for your question. My child has some extra medical needs. Is there a way for me to speak to someone at CK Public Health prior to them booking an appointment?
Yes, I would say absolutely. Give us a call about your child and what you feel their needs are. Dan, I think our information is still there on screen, or we'll put it up here at the end, and then you can reach out to us directly and speak to a nurse about your child's specific situation.
Yeah, and if it's medical related, it might be better to speak with the treating physician or any specialist that your child sees and
Right.
have a discussion with them to determine the appropriateness of vaccination or an appropriate timing for vaccination. But if it's not so much related to medical situations, which sounds like Jill's is, then certainly give us a call. But if it's related to your child's specific medical needs and probably better to have that discussion with the treating physician to determine the appropriateness for vaccination. The next question on screen, once I receive both doses, do I still need to wear a mask? I can take this one if you like. The answer is yes. We covered it in the presentation. So mask wearing and physical distancing and hand washing and all those important public health measures are definitely still going to be required until we reach a point where we see cases falling off to the point where we don't feel like we need them. I believe the provincial government has targeted the end of March for lifting of masks. Now, of course, that's a goal. We've already had a November 15th plan put on pause to lift capacity limits in venues. So I think that March 22 is sort of a hopeful target. But absolutely, until the province lifts the public health measures, please continue to wear your masks, to physically distance, to perform hand hygiene, provide your vaccine certificates when you're going into public places that require them, et cetera, et cetera.
It looks like we have time for one more question, Dan. Does that sound
Okay,
okay?
yeah, let's take one more then. How effective and safe is the vaccine in children? I think I covered it a little bit in the presentation, saying, about 90.7% effective versus severe disease, no safety signals so far. Anything else to add to that?
I don't think so. Like we mentioned before, too, there was very little, like side effect wise. It's just those typical local effects, that pain, redness, a little bit of swelling, and then occasionally the headaches and a little bit of fatigue and whatnot. But as you mentioned in the presentation as well, this was even less than in the adult and the teen population, right? So that lower dose has really helped to make this, I think, a good option for children to protect themselves.
Yeah, I agree, Kim. And I guess I just want to close by saying, like, we're both parents too, right? And even though I can't speak for you, but even though I'm a public health nurse, I didn't immediately say, yes, absolutely, I'm going to get my child vaccinated. When you're a parent, you're concerned about your children, right? And you want to do what's right for them. Um, but I know, especially in helping prepare this presentation and reviewing all the information, I definitely feel a lot more comfortable about it. And I'll be getting my children vaccinated. Um, it is an important decision. It can be a bit of a frightening decision, but definitely something that I think is important for people to take serious consideration of and to make the choice that feels best for them and their family.
Yeah, I think absolutely we need to acknowledge that parents, ultimately, everyone wants to do what's best for their child, right? So take the time, do a little bit of research into this, reach out to us if you need some more assistance from us, or otherwise another source that you trust.
That's great. Excellent. Well, I would like to thank you tonight for being here, Kim, and helping me work through this and provide some answers to some burning questions out there in the community. Of course, like Kim said earlier, this is not where this ends. If you have any other questions or concerns, reach out to us through our channels. Give us a call. I don't know if we can get our contact information back up on screen here for people before we leave. But if we did not get to your question, we apologize for that. Please send it in to our email ckphumcommunications@chathamkent.ca, and we'd be happy to provide you with a response to your question. Of course, this video will also be available for viewing afterwards on our YouTube channel. So share it around with any friends or family that you think would benefit from it. And other than that, I think it takes a little bit of time for that YouTube video to get processed before it's posted. So it might not be there until a few hours from now. By the morning, it should be. But anyway, look out for that. And without any further delay, I will say thank you, Kim. Thank you to our behind the scenes team. Thank you to the audience that joined us tonight and those that took the time to ask us questions. We hope this was helpful, and we will say good night. Take care, and see you again soon.
Thanks, everyone.